as toxic haze continues to blanket the national capital, the centre informed Parliament that Delhi has recorded its lowest average AQI this year since 2018. The only exception was 2020, when the air quality was exceptionally clean due to the lockdown. Now, responding to a question in the Lok Sabha on Delhi's persistent pollution mess, the Union Minister for Environment, Forest and Climate Change, Mr. Bhupendra Yadav, said that the number of good days in the city when AQI remains below 200 has increased to 200 this year, up from just 110 days in the year 2016. He further goes on to say that the overall air quality improved this year with fewer number of very poor days when the AQI is between 300 to 400 and severe days when it goes beyond 401 compared to last year. Well, the government statement comes when residents are grappling with very poor to severe levels of AQI for the past 2 months, triggering multiple protests by residents who described the situation as a health emergency. Now, doctors have been warning against prolonged exposure to this toxic air, calling it nothing short of slow poison, which is silently cutting short the lives of the residents. So we went through some of the data and spoke to experts to understand if Delhi really did have the cleanest air in 8 years. Firstly, compared to last year, the peak pollution this winter was definitely less. According to the latest winter air assessment done by the Centre for Science and Environment, the October-November PM2.5 average was 9% lower than the previous year. So even the worst peaks appear slightly reduced. A major factor was, of course, the drastic fall in stubble burning incidents in Punjab. Now, the satellite data from the Indian Agriculture Research Institute showed that the incidents in Punjab dropped from nearly 50,000 in the year 2022 to about 5,000 this year. So the contribution of stubble burning to the episodic peak in pollution was definitely less. But experts caution that the overall pollution in Delhi remains hazardous. In fact, the concentrations of PM2.5, PM10, ozone and other harmful gases remain well above the limits set by the World Health Organization. Experts note that Delhi needs more than a 60% reduction in the ambient air pollution to meet its own clean air standards. Now, the same assessment shows that while the attention remains largely on the daily PM2.5 and PM10 peaks, the rising levels of equally harmful gases, nitrogen dioxide and carbon monoxide, have largely gone unnoticed. Experts warned against the harmful effects of carbon monoxide, which is predominantly emitted by vehicles and has shown a widespread spike across Delhi this winter. At least 22 monitoring stations recorded carbon monoxide levels above the 8-hour standard on more than 30 of the 59 days, indicating persistent traffic-linked emissions. Dwarka Sector 8 was the worst affected, with 55 exceedance days, followed by Jahangir Puri and North Campus, Delhi University, each reporting about 50 days of violations. Now, this cocktail of pollutants also makes the air more toxic to breathe. To make matters worse, experts also raised alarm over the increase in the number of pollution hotspots across Delhi. In 2018, about 13 hotspots were officially identified, where the pollution levels exceeded not just the standard levels, but also the city average levels. Now, there are many more, including places like Vivek Vihar, Nehru Nagar, Alipur, Siri Fort, Dwarka Sector 8 and Patparganj. And as one of the experts pointed out, the winter air definitely looks better when compared to last year's extreme, but in real terms, pollution remains consistently high. Meanwhile, scientists also caution that weather plays an important role in Delhi's air quality, and this year, Delhi experienced an excess monsoon with well-distributed rainfall from June to September, which also helped settle the pollutants. So perhaps we need to be a little more cautious before interpreting this data. Delhi remains one of the most polluted cities in the world, with levels of harmful pollutants far exceeding the level set by the World Health Organization. So clearly, any long-term improvement requires urgent measures in priority sectors like transport, not just within the city, but across the entire airshed.
Fighting so long and so hard that they don't know what the they're doing.